Hello there. So today I'm going to talk to you about some of the other products that we can use in allergy patients. So these are not products that are intended to replace long-term allergy medication. These are usually ones that are used in conjunction with long-term allergy medication. Number one is antihistamines. So antihistamines like Benadryl and whatnot are not nearly as effective with dog and cat allergies as they are with human allergies. But we can see some that it does help it a little bit to give those. So it's still recommended to give it a try and see if it makes a difference. Thankfully, most vets will give you a sheet that kind of lists all of the over-the-counter allergy medications and some of the different dosages for those. Also, for skin allergies, there are a lot of over-the-counter chews that you can use. I know a lot of people have heard of Zesty Paws before. There's one I really love called Dermaquin, and kind of the point of those chews is not to replace allergy medication, but is to try to increase the interval between having to give the allergy medication. So for example, if normally a dog has to get Cytopoint every 5 weeks, and they take one of these and now they can get it every 7 weeks, that's beneficial because that's less doses over the course of their lifetime. Also, there are a ton of topical medications to use for allergy patients. There are anti-yeast wipes, there are shampoos, there are mousses, there are creams, there are all kinds of things. I personally suggest for any allergy dog discussing with your vet about a medicated shampoo, picking one that's specific to them. Some of them have Benadryl in them, some of them have antibiotic, antifungal. Kind of the big thing with any type of shampoo is it has to contact the skin for about 10 minutes before it's rinsed off, because whatever product is in there has to actually touch the skin for a while for it to be effective. So personally, I always suggest a medicated shampoo, and I love the new age medicated mousses that they've come out, especially for dogs that have chronic issues with their feet. So we used to send home sprays or get them to soak the shampoo in the feet, and dogs hate it. But these new age mousses you can put on and rub in between the toes, and it absorbs relatively fast, and you don't get that spraying action that they hate. You don't get that making them stand in the water that they hate. And so that's something that you can definitely discuss with your vet about seeing if one of those products might work for your kiddo. Obviously, you can't really use a mousse on a face if you have a dog with a lot of facial issues, but they do make wipes and stuff for that. But as annoying as it can be to have multiple different products and have a prescription food and have an injection and all this different stuff for allergy patients, that really is what you need to keep their allergies completely under control, or at least get to 75-80% of control, is hitting it from all of these different directions. And if you bring in an allergy pet that has a lot of infections at the beginning, just get ready. That first visit is going to suck, because it's usually going to involve antibiotics and antifungals and shampoo and all of this different stuff. But if you don't hit all of the different aspects of that multimodal, you will not get the allergies under control. If you have any questions about allergies, please pop them in the comments. I know this is a very complicated topic. If there's anything allergy related I didn't talk about that you want to learn about, let me know and I'll make a video in response.